I interrupt our Independence Day celebration to refocus the collective mind of the nation on the COVID-19 threat, which is still real and which is still a significant threat to the health and safety of the nation. As usual in these press conferences, I will start with our graphs. On the first graph displayed, which should be appearing on your screen just about now, the solid black line shows the cumulative number of cases up to today's date. We now have 958 cases. That means we have had today 30 new cases identified. The dotted black line, which should be appearing now, displays the number of cases without the workplace cluster. Unfortunately, since our first case, we have had 12 deaths, as depicted by the red line. And these are sad realities of the pandemic. I wish to express to the family and friends of those who have died as a result of the disease the condolences of the government. But this also brings to bear how dangerous this pandemic is and the toll that it can take on the nation if it is not properly managed. The green line, which you should be now seeing, shows that we have had 745 persons who have recovered from the disease. Our recovery rate now stands at 77.7%. The final line on the graph, which is the blue line, shows that we have 149 active cases, and that is the number of persons who still are infected by the virus. As of yesterday, we've had 40 persons hospitalized, including suspected positive cases of COVID-19. We've also had 10 persons isolated in a government facility, 79 isolated at home, and 2 quarantined in a government facility, and 23,449 persons quarantined at home. The Ministry of Health and Wellness will provide further updates. Now, the second graph, which you're now seeing on your screen, shows the effect of the controlled entry program on our numbers. The dashed purple line, which you should now be seeing, shows the number of cases excluding the positive cases from persons arriving under the controlled entry program. You can see that our curve has been relatively flat except for the last 5 or 6 days, when we are now seeing an uptick in local cases. We have had 337 imported or import-related cases under the controlled entry program since July 1. We have had 256 new cases, of which 170 are imported or import-related. Of these imported cases, 52 have been repatriated. You will recall we had done a simple projection of the numbers of cases that could result from the acceleration of the controlled entry program based upon a 0.7 positivity rate that we had observed after June 30th. This projection is shown in the dashed black line, which should now be appearing on your screen. We had said that this line will act as a threshold or trigger if our cumulative numbers start to rise. And at that point, we would have no choice but to consider tightening the measures, which would include closing the borders. While we remain below this threshold, the recent uptick, as you can see, is cause for concern. Our trend line is heading towards the trajectory of the trigger line which we had put in place. We were always prepared that this possibility of an increase in numbers would arise. Therefore, we have been on alert and we have been planning for this eventuality. And this is why we have been able to act so quickly. You would recall the emphasis we have been placing on surveillance and contact tracing within communities. And I would pause here to say that the previous debate has focused heavily on testing. Testing is an absolutely important component of our response strategy, especially to confirm the number of cases. But what we have not emphasized, what the nation has not paid close attention to, and which we should pay even more attention to, is the surveillance that is carried out by the public health system, by our public health officials, by our nurses and doctors at our hospitals and clinics. And it is this which would have provided us with literally real-time information, which has enabled us to be able to respond in this way. You would also note that the Minister of Health, in terms of developing our response strategy, would have ensured that the country has more public health aides who have been trained to go into communities and assist with contact tracing, assist with education of persons, and in identifying potential cases. And they are, I would say, Minister, about 70% mobilized, thereabout, and they are active and around in communities, and that is also part of our response strategy. So, given that we now have this data, and we have it in real time, we met today, the Cabinet Subcommittee, we call it our COVID-19 Subcommittee, and even on Independence Day, which is a public holiday, the nation should be assured that your ministers are working in your service. So we had our meeting today. We started at 10. We were projected to finish at 1. We ended up going on until almost 3 p.m. because there are many issues to discuss, and we have to make sure that we have all the information and our strategies and approach are correct. You would have seen earlier today or yesterday that we declared a community under quarantine, and this was a community in Clarendon. Today, we will also declare another community, this time in the parish of St. Thomas, which has not seen much activity before, but we are now seeing activity which is cause for concern. The Minister of Health will give more details on the communities, and specifically the new community in St. Thomas, which will be under quarantine. Now, in relation to the areas that are identified for quarantine in the parishes of Clarendon and St. Thomas, as we had done before, we will impose measures under the Disaster Risk Management Act to restrict movement and allow our health team the space to undertake their surveillance, their further surveillance, and related activities. This is being done to ensure that the threat of exposure to COVID-19 are mitigated as far as possible. Residents in the areas will be under curfew for a 2-week period ending August 2020. Therefore, I would want all the residents in the areas identified to cooperate with our health officials and the security forces. Now, prior to the end of the period, a review will be conducted to determine whether the quarantine period will need to be extended. During the period of the all-day curfew, residents in the communities specified for quarantine will be allowed to leave home on what we refer to as shopping days. And generally, the shopping days are Mondays, Wednesdays, and Fridays between the hours of 9 a.m. to 2 p.m. On the shopping days, persons are allowed to leave home to go to the closest practicable location to obtain food, medical supplies, access financial services, and then immediately return home. Although, due to the unfolding circumstances in the St. Thomas communities, tomorrow, Friday, August 7, 2020, residents will have to remain indoor. We know that Friday is usually a shopping day for most, but the situation is such that the community needs to be brought under control, and movement is an important part of that control. And so we have to prevent movement as of tomorrow. Well, starting now, we have to prevent movement. Persons will be allowed to leave home, even if it is not a shopping day, to obtain urgent medical care or to fill a prescription. In that regard, we intend to have the National Health Fund Drug Serve mobile units available to serve affected communities. If you have to leave home, especially when it is not a shopping day, please ensure that you have proper identification on your person to present to the security forces. Now, vulnerable persons and those families in need of care packages are assured that they will be supported by the relevant agencies, specifically the Ministry of Labor and Social Security. Markets in the affected communities will be closed for the entire period. Persons are being urged to heed the warnings of the health authorities and the security forces during the period. If you are in the communities and you are exhibiting symptoms of COVID-19, please alert the health authorities. Now, although we have been aware of the possibility of more cases, we need to take these developments very seriously. As I've said in every speech I've made since the first case in March, our response as a government must be based on evidence, measured, and proportionate. In every speech I've made, I start off by encouraging Jamaicans to faithfully and consistently follow the infection prevention and control measures. And by now, every Jamaican should know what those measures are. Wear your mask when you're in public. Wash your hands regularly or sanitize if you are not able to wash your hands. Maintain social distance as far as possible. Try maintaining 6 feet apart when you are gathered. And if you have to sit in a meeting or attend an event, the organizers have a duty to ensure that chairs and tables are spaced appropriately, observing the 6 feet apart or 36 square feet minimum per person. That we call the physical distance. And an important infection control measure is that if you are ill with respiratory symptoms or flu-like symptoms, meaning you have a fever or you have difficulty breathing, or if you have a cough, if you're sniffling or sneezing, stay at home. And for those who don't understand that, tana your yard. Now, I've always said that if the situation warrants it, then we will have to extend existing or implement new restrictive measures. We have spent a lot of time and effort and resources on moral suasion, asking you, the citizens, appealing to your good conscience and your reasonableness to observe the protocols. With what is happening now, I think we are at the limit in moral suasion. I think whilst we will continue our advertising campaign, we will continue to encourage, we will now have to move into another phase of managing the pandemic. And I say we have to move into this phase because the Disaster Risk Management Act is a very useful tool for managing these kinds of disasters, these kinds of emergency situations. But we have sought to address it by appealing to the good conscience and reasonableness of our citizens. And indeed, my own view is that we have the majority of Jamaicans who are reasonable and who try their best to comply. But we have some weak fences. Some people who believe that they have some special immunity to the disease. We have some people who it would appear that they would do everything possible not to observe the recommendations of authorized sources. We have some persons who appear that it is their existence in life is to flout the law. And what they have done is to put others at risk. When I hear the inside stories about how persons have died as a result of COVID-19, when we hear from contact tracing how people actually contracted the virus, not following the measures. We have had a discussion today with members of the umbrella group of churches. And I must here state that the churches in general, particularly those that are part of the umbrella group and other established churches, have by and large supervised themselves, and many of them have put in place measures over and above what we have put in the Disaster Risk Management Act. Our challenge, however, are with those churches who continue to operate in such a way as to totally disregard the measures that are in place. We have a case of a pastor who returned to the country, a Jamaican pastor, and held services, held conventions. When we visited the church, the reports we had was that none of the protocols were being followed. People were there without masks. They were all gathered in a very close way. There was no temperature check being done at the door as we require. There were no hand sanitization stations. It was a total disregard for the rules. I interpret that, however, as a total disregard for our fellow Jamaicans. Now, we are seeing 30 cases today. Many of them are related to that one incident. My own view is that the authorities who are empowered by law should act and should send a strong signal to those who flout the law in this way. You know, there will be, as a result, significant calls for us to shut down our economy again, take measures to shut down the economy, because that is the sense of fear that many Jamaicans will have. Now, the irresponsible behavior of a few has created a significant dilemma for the government. Our economy has taken a massive hit. I have been to some communities over the past few days, gone into the craft markets, checked on some of the resort towns, and they are feeling it. But 1 week fence could undermine the entire progress which the economy has been making. So the cabinet has contemplated stricter measures, and we have narrowed down the list of recommended actions that we will take. We will not announce them today because, as is the practice, whenever we're going to take some measures, especially those that impact significantly on stakeholders, we tend to consult, and some measures require that we give notice. So today today still is a holiday. We were not able to consult with all stakeholders. Between tomorrow and Tuesday, when we go to Parliament, we should finalize what we have decided to do, and those will be reflected in a new Disaster Risk Management Act order. It does contemplate measures affecting the places of worship. We have agreed and we have consulted with some of our church leaders that conventions and conferences for churches should be prohibited. Now, to be fair to the churches, and I have to point this out, I would suspect that all the churches within that organization, and indeed other established churches, would have already, many of them, postponed or canceled conventions that were due to be held. So they were acting responsibly, even without the government placing it into the order. However, I think it is now necessary for this to be specifically placed in the order. And it would therefore be one of those acts which would attract a penalty. So, we've also contemplated what we will do with entertainment. We will not say that today, except to say that I hear the cries. I got a voice note from one popular entertainer, and I will call his name. He's an entertainer. He wants his name to be called. Anyway, Ricky Trooper, I've heard you, sir. I've heard you. And many others regarding the investments that they are making. Now, you have ministers who understand entertainment, Minister Mackenzie and Minister Grange and Minister Bartlett. They are sympathetic. We are sympathetic. We understand. But we ask you to understand that we can't put the entire country at risk. If we allow entertainment to emerge, then we expect that you must be responsible. And as we have been using moral suasion, entertainers are more influential than politicians. So if you truly want your industry to re-emerge, use your powerful voice to encourage the people who subscribe to your parties and attend to follow the protocols. You see, friends, Jamaicans, on this our Independence Day, we can't hide from this disease. We can't hide from this virus. We're going to have outbreaks over and over and over again. Despite our best efforts, someone will act irresponsibly. And even when we all act responsibly, there will be events beyond our control. And therefore, the solution is not always to go into lockdown. We have to go into lockdown to bring things under control. but the solution is to ensure that every single Jamaican is a strong fence, that we act responsibly. That's the only way. And we have stood at this platform and on others, and we have said we will prosecute, but we are very reluctant to do so. But I believe now, I am certainly convinced in my mind, that the only way that we are going to be able to confront this disease, keep our economy going, ensure that we can recover from the recession and remain healthy, is to prosecute those who deliberately go out of their way to ignore the law and place all of us at risk. We have also contemplated actions as it relates to beaches and rivers. Now, again, I get all the clips and the pictures, and when I see them, I send them on to the security forces and I ask whether or not this is true or not. Because the impact of social media and other people sending you material is that it could influence you in the wrong way. So a part of my own verification is that whenever anything comes to me, I check it. So yes, some of the pictures that we have seen are not true, are of events past. But we can confirm that there are some beaches, and we have seen them, that people are attending those beaches and rivers and they are not following the protocols. The Minister of Local Government will, between now and Tuesday, make some announcements regarding beaches and rivers. Under the Controlled Re-Entry Program, which specifically has to do with how Jamaicans and non-Jamaicans re-enter the country or enter the country for the first time, we have contemplated some measures around requiring tests before entry, which we call pre-testing. We have contemplated measures regarding quarantine. I can say that we have decided that residents and Jamaican, well, the term to appropriately describe would be Jamaican residents, including those who don't have a Jamaican passport or citizenship, but who live in Jamaica. So anyone returning to Jamaica must go under quarantine. Anyone who is visiting Jamaica must go on quarantine. Now, as it relates to persons coming to visit the Resilient Corridor, those persons will continue to be under the stay-in-zone order. And the stay-in-zone order is going to be policed on a stricter term. In fact, I was told today that the police have actually started to seriously police the corridor, and they have actually arrested and charged one visitor so far. So we are going to be strictly enforcing the rules. We have tried, and as a government, I think we have been very reasonable, very understanding, and indeed, my own view is that most Jamaicans have complied. But when we get 30 cases in one day, which we can track back to individuals and irresponsible behavior, then we must act and act seriously. So, ladies and gentlemen, my fellow Jamaicans, on this our Day of Independence, the day when we celebrate Jamaica taking on its own sovereignty, and the period when we celebrate our freedom as a people from enslavement, we must recognize that freedom is not free. And though you are free and independent, You are not free and independent to do as you like to the detriment of others. Every citizen has a responsibility to follow the protocols, to ensure that if they are ill, they stay home. If you return to the island, do not go and look for grandma and grandpa and your old auntie that you haven't seen in how many years. Call them on the phone. We have had persons dying as a result of coming into contact with persons who have visited from overseas. I should mention as well that we are going to have tighter restrictions on funerals, because we are also picking up that many persons are coming back to Jamaica simply for the purpose of attending funerals and leaving more people behind to die, only to come back again for another funeral. No. So where we are now is that we're going to move into a different phase of the management of the pandemic, and that is strict enforcement, because it is now clear to us that despite our best efforts, and despite the best efforts of the majority of Jamaicans, as my grandmother said to me when I was a child, if you can't hear, you will feel.
Thank you very much, Prime Minister, colleagues, Mackenzie, Desmond Mackenzie, Permanent Secretary Sewell, and Bisesa Mackenzie, distinguished ladies and gentlemen. The Prime Minister gave a fairly comprehensive overview as to what is happening. I just want to maybe emphasize a few things, but also add to the narrative in terms of some of the specifics that related to the communities that have been quarantined. Firstly, I want to use the opportunity just to thank the public health team because, you know, the shift from a strategy of keeping COVID out to managing COVID within the society, or living with COVID, as some would say, does require a different orientation, and ongoing surveillance is critical to that process. And the truth is that the public health team has been monitoring on a daily basis the cases that come up in the public health system, and where there is a need for further investigation, those investigations are carried out and a determination made as to whether or not the intervention at the community level is done in a way that requires the quarantining arrangement as has been announced, or we move in without much fanfare, without much notice or publicity, and deal with cases that may be ad hoc or not sufficiently a threat that would require keeping persons in one place for an extended period. And so I just want to make it clear that the approach is one that we should expect from time to time, and it is part of the management of the process that is intended to allow life to resume normality, whether it's work, play, or otherwise, as indicated by the Honourable Prime Minister, but at the same time ensuring that we conduct the necessary surveillance to deal with the threats when those threats emerge. There are a number of communities that we are in now actually assessing what is happening. I mean, we're in St. Catherine in a few places, in the KSA area, in St. Mary. Again, not elevated to the level of having quarantine arrangements, but just to say that the public health team is out and are engaged. The other point I want to make is that we have almost 25,000 Jamaicans, just under 25,000 Jamaicans who are in home quarantine arrangements. And unlike in the past when we had much less Jamaicans in those arrangements and more persons in government-controlled institutional home quarantine arrangements, the control mechanism was different. And the fact is that the risk profile does increase when you have persons who are at home. Frankly speaking, as was said by the Prime Minister, not all observe those arrangements, whether within the home and their contacts with their family members and friends, or moving outside of the home when they are actually not supposed to. And importantly also, those arrangements require ongoing communication with the health authorities, particularly if you are symptomatic. If you are coughing, if you have, all the symptoms that we have outlined, and you stay with those symptoms or try to self-medicate, then you're putting yourselves at risk, and of course others around you, because the transmission of the virus becomes a lot more once those symptoms occur. And indeed, as very unfortunate, but the last 2 deaths that we had were persons who presented to the hospitals late and died, unfortunately, within 24 hours of presentation. And what that indicates is that they were at home with symptoms and did not turn up. And I want to just... Rural parishes, yes, and came to hospital, Prime Minister and colleagues and Jamaica, when they were in an advanced state of respiratory distress, so they couldn't breathe. And at that time, they never left the emergency room because of the advanced state that they were in. So a critical part of the protocol that we continuously emphasize is that if you are ill, if you have symptoms, you need to make contact with your doctor or the local health center or the hospital as quickly as possible, so that your chances of being treated, diagnosed, hospitalized if necessary, is done in time and enhance your chances of recovery. So the Prime Minister said 30 new cases in 24 hours. This is probably the largest numbers that we have had. Just to say, before the question is asked, 4 of that 30 are cases that are part of the backlog that we're clearing up. The other 26 are current cases that have been tested based on samples received over a few days. I know persons are concerned about the backlog, and we're working on the backlog, but just to say, we operate on parallel tracks where we are now managing the samples that we collect on a daily basis to test within a few days, while at the same time trying to clear up the backlog. Of the newly confirmed cases, 19 are females, 11 males, 4 imported, as said earlier. The other 26 cases are 11 from Clarendon, 11 from St. Thomas, Kingston and St. Andrew 2, St. Catherine 1, St. Mary 1, and 5 of the 26 cases are contacts of confirmed cases, with 21 of those cases under investigation. And just to say that under investigation is an indication of community transmission, because we now have to trace the origin. These persons present, they have the virus, and the health authorities now have to go back to look at their history and then determine as best as possible where they would have picked up that virus. In terms of the classification, we have 352 imported cases, 286 cases contacts of confirmed cases, 62 local transmission cases not epidemiologically linked, 236 related to workplace cluster in St. Catherine, and 22 under investigation. 10 of those cases, which led us to the challenges in St. Thomas, 10 of those 22 cases are from the specific area of Bamboo River, Church's Corner, and Summit. And we will just explain that a little more. We saw an uptick of cases in the parish of St. Thomas starting on the 31st of July. The team has been in the area working very hard over the last few days. That particular case led to the discovery of additional cases, 5 cases, which were confirmed a few days after, then 9 additional cases, and 13 in total cases coming from the particular area that we have taken a decision to quarantine for further investigations. The breakout of the 958 positive cases, 745 or 77.8% have recovered, 52 or 5.4% have repatriated, and 12 or 1.3% have unfortunately passed. There are 149 or 15.5% active cases currently under observation, including 7 moderately ill persons. And those, of course, we have to monitor very carefully. We've done some 41,840 tests to date, and 541 new samples over the last 24 hours. And in addition to the 958 positives, there are, of course, 40,835 negatives and 47 that are pending. Now, back to St. Thomas briefly. What we have seen in St. Thomas over the past 4 days are approximately 28 positive cases. And that led the authorities to go into the parish and to do surveillance, more direct and targeted surveillance across the parish. But the particular area in question under quarantine have been, in their estimation, viewed as areas that required a lot more and in-depth examination based on what was discovered. The origin, and maybe the CMO will give better details on this, of these cases, and highlights the need for us to be vigilant and to observe the protocol. The origin of these cases are quite interesting. It only takes one infected person to create the challenges that we face at the community level. In the case of St. Thomas, it was an individual who originated from St. Catherine, had symptoms, went into the parish to visit family and friends in the generalized area, went to church, based on the contact tracing information, was prayed for by the congregation based on their particular illness, and that led, this is a summary of course, to a case of members of the congregation, friends who they visited, and relatives being infected by the virus. So one person who traveled from an adjoining parish into that location, and this has led to the quarantining arrangements. Again, if you have symptoms, report it to the doctor, visit your health center, visit your hospital. That is the way we can determine at this time whether or not you need particular attention and whether you represent a risk. Don't take chances, don't resort to home remedy. And frankly speaking, while we certainly encourage you to pray and give God thanks and ask for guidance, I think it's also important for you to visit your doctor and to get the medical or clinical advice on the particular situation. So the quarantine area in St. Thomas as of 7 p.m. tonight is as follows. Prime Minister has asked me to just read this up. Church Corner quarantine area, the area of interest spans approximately 0.9 square kilometers and is bounded by a 4.3 kilometer perimeter. North, the boundary will start at the intersection of the Morant River and the Bustamante Bridge and will continue in a northeasterly direction along the Roselle to Morant Bay Road to the roundabout, and then continue along the perimeter of the Red Hills Cemetery to the intersection with the Summit Boulevard, and then easterly where Stony Gut Avenue and Paul Place intersects. Then the boundary will continue southeasterly for approximately 0.2 kilometers to the intersection of Summit Road and Summit Grove, and then due east for approximately 0.3 kilometers to where it meets the river. East, the boundary will continue in a southerly direction along the river to where it meets the coast. South, the boundary will continue from where the river meets the coast and then continue in a southwesterly direction along the coast to where it intersects with the Morant River. And west, the boundary will continue in a northwesterly direction from the coast along the Morant River to its intersection with the Bustamante Bridge. That information will be made public. The constabulary and the JDF are on location, supported, of course, by the health team, and we certainly would appeal to persons within the boundaries of this particular space to please observe the quarantine arrangements. It's there to protect you. The health team will be in the area. The Ministry of Labor will be giving support as it relates to supplies, the National Health Fund and others. And again, the more cooperation we get, then the sooner we can manage the process, reduce the risk, and life can go back to normality. And of course, this affects Bamboo River and Church Corner and Summit, where we have had some 16 cases, I am told. We have announced the boundaries of Sandy Bay, so I won't go over that, Prime Minister. The team is in place and work is currently being done on the ground, and that will continue for the next 2 weeks. So far, persons have been very cooperative. The same rules apply, as is the case of St. Thomas. And again, I want to say it took a case in this instance of one individual who came back from abroad. We initially discovered that there was an issue based on a presentation at the Maypen Hospital. We traced back to the home of that individual. 5 members of her family were infected. 1 member is a dominant player, a pastor or deputy pastor of a particular church. The contact tracing led back to the church, where it was discovered based on another person who was positive, to another church where the team visited, where church was in session, and as the team describes it, absolutely no protocols were observed in terms of the physical distancing, the wearing of masks, and persons were closely seated. There were 3 members in the church at the time when they were visited that had symptoms. They were ill, so they were coughing. And of course, that led to quite a number of members of that church being infected. It was eventually discovered that the deputy pastor of the church had come back from the US and was positive, and that seems to have been where it all started. You know, our health team, our contact tracers do a very good job in investigating each case, and they eventually get to where the source is. But it all starts with a source, and that source is normally a number of 1. And as a consequence, many others are impacted. So again, we cannot stress or emphasize how important it is for Jamaicans to observe the quarantine arrangements, the protocols as it relates to general behavior, the wearing of masks, the physical distancing, the reporting if you're symptomatic. And for those who have been asked to stay home, we need the support of the community to ensure that persons comply. And as the Prime Minister said, if we have to increase the enforcement mechanisms or measures, we will certainly be doing that. I just want to finally reassure, as the Prime Minister has done, the country, that we are going to have these cases popping up at different points throughout the country. And the ministry, supported of course by the government, is prepared to deal with these cases. It was always envisioned that once you begin to lift restrictions, allow more persons to come in, restore a sense of normality for persons to go to work, play, otherwise, you're going to be taking on greater risk. And so that's why we're training over 1,200 community health aides and deploying them. That's why we're going to be adding over 100 more doctors, medical officers. Public health inspectors are going to be added also. And that's why we have to continue the messaging. And the team is out there, they are mobilized. I've been around the country over the past week in some of the training sessions. They are motivated, they're working hard, and they are playing their part. And so when these things happen, it's not a call to panic, but it's important for us to recognize that a lot can be avoided if we all play our part. Everyone counts. That's our motto in the Ministry of Health. We need to play our part. And if we do that, I think we can cauterize and neutralize these risks once they appear. Thank you very much.
I don't think I'll take off my mask.
Thank you very much. Thank you very much, Minister. Thank you very much, Prime Minister. Ladies and gentlemen of the media, we'll take just a few questions. The Prime Minister has indicated that it is a working holiday. He will not say, but let me say that the Prime Minister actually has another meeting to rush off to. So let's just quickly take some questions, as many as we can. I see and recognize Brittany Clark from Nationwide first, and I think I see two other hands that are up. Prime Minister, Brittany, you can go ahead with your question, please. All right, we're not hearing Brittany at all. Have you unmuted your mic? We're not hearing
Unmute your
her.
mic, Brittany.
Okay, are you hearing me now?
We're hearing you perfectly now. Go ahead, please.
Thank you. All right. Prime Minister Holness, one of the issues you mentioned was regarding quarantine. But we understand that home quarantine regarding that persons were simply not staying home. So what will the security forces...
I'm sorry, Brittany. Could we just ask that your volume be turned up a bit?
All right, so could you start over again for us, Brittany? Go ahead.
Okay, can you hear me better?
Yes.
Okay, great. So the issue surrounding quarantine, we know that one of the issues was that persons were simply not staying home. So what exactly would the security forces and the state be doing differently to ensure that persons who must be in quarantine will actually remain in quarantine or be held accountable otherwise? Will there now be in-person check-ins by the security forces, or will the government be expanding their quarantine facilities, or what exactly will be in place?
So you would have heard, that we have just under 25,000 persons in home quarantine. There is absolutely no way that the state can check everyone. However, we do have methods, which we won't reveal all of them, but you have the Jam COVID-19 app, which does some amount of geofencing, and if that is breached, we have a monitoring station, which allows us to identify the person who has breached. Now, each breach would have to be investigated, because there are a variety of things that could cause the geofence breach. The police and the health officials make random checks at times at addresses. And obviously, if you should be at home under a quarantine order and you're not, and an authorized officer establishes that you're not, then you would be in breach. And of course, each case would turn on its own evidence. So the issue now is for the government to use all the methods at its disposal to go through the process of charging, which would mean a certain amount of investigation, some amount of surveillance, and then bringing these cases to court. You can imagine that this could literally divert resources from other important crime fighting and public order, safety and security initiatives. But what we are seeing here is an emergency, and I believe that the security forces ought to treat it as such and place some effort towards ensuring that those who breach the law are prosecuted. Certainly, where we find clear cases identified by the Ministry of Health, those should be investigated, and the persons who are culpable, who are at the cause of the spread, should be prosecuted.
Thank you, Prime Minister. We go over to Althea Saunders at the Jamaica Observer. Althea? Again, we ask everyone to be identified. Just unmute your microphone for us. Althea?
Hi, good evening. Are you hearing me?
Yes, go ahead, please.
All right, I have 2 or 3 questions. The first one is the Ministry of Health has said that since June 1, the majority of positive cases have been imported. Is the government considering closing our borders to countries that do not have COVID-19 under control? And the second question has to do with the pre-testing of visitors. Have you been able to gauge the effectiveness of this, and have we seen anybody coming in after having sent their negative results? They arrive here, but they end up being positive. are we seeing any of that?
So, Althea, let me just answer your first question, and then I'll invite the Minister or the CMO to give the specifics on the second. So your first question is the government contemplating closing of our borders? That is always on the list of things as to whether or not this is something that we will do now. There is no decision on that. Our posture is that we will have to learn to live with the pandemic. We'll have to learn to live with the virus. And those would be considered your last resort. If you start to close your borders on every single outbreak, your economy will never recover. And you literally could keep yourself in a recession. So there are other methods that you would have to use to control the outbreak before you reach to those extreme measures. But just to say that they're always on the list whenever the cabinet meets, that is always discussed. We always look at what the circumstances are and apply the measures that are appropriate, proportionate, and measured. CMO or Minister? The CMO will.
Hi, good evening, everyone. So, in terms of the pre-testing, yes, we have seen some benefit from the pre-testing. One, persons are a lot more aware. Persons recognize that we are taking this thing seriously in Jamaica, so they're making the effort to get the test done. And it has also caused a delay in our process of persons coming here, slows it down a bit so that it's a little bit more controllable. In terms of the actual test result, we do recognize that there will be persons who will come in that may have had a negative test and could have gotten positive within the period that it took for them to get here. So we do expect that there's going to be some of that. And we do expect also that persons would have tested positive and have found some way to have come here with a negative result. Let us leave it at that. So our point where we are in the managing of the epidemic is that we treat everybody that is coming in as if they are positive. That is why we have put in all these rules and policies, protocols for the management of how we operate in different institutions. We have to treat every single soul as if they are positive. The rules are not there to protect you from somebody who does not have COVID. The rules are there to protect you from somebody who has COVID. So therefore, we have to stick to the quarantine measures, and we have to ensure that other persons around us stick to the infection prevention and control measures to prevent themselves from becoming exposed, to prevent themselves from becoming infected. Thank you.
Thank you so much, SMO. Thank you so much, Prime Minister. We did point out that this is a working holiday for you, and so I know you have another meeting that starts at 8. We thank you so much. We also have the Acting Permanent Secretary in the Ministry of Health and Wellness, Ms. Fabia Lamb, who is here with us, sir. We just want to thank you for your time and spending time to at least answer a few questions, even on a busy holiday such as Independence Day.
And my apologies to the press. I really have to go. If Minister Tufton would like to stay and entertain you a little bit more, if there are questions.
All right, so members of the media will take just 2 more with Minister Tufton. Let's then go to Damien Mitchell from the Gleaner. Damien, real quickly. Go ahead, Damien. I'm sorry, can you unmute, Damien? We're not hearing you.
Yes.
Yes, go ahead.
Thank you. Dear Minister, there's an area we haven't heard much about, and that's the issue of the prisons. Can you indicate the outcome of your assessment in respect of the COVID containment protocols in penal institutions?
Okay, well, first of all, let me say that we do have a protocol as it relates to a number of our institutions, prisons, infirmaries, and in terms of the prisons, we have not had any cases of COVID in those institutions, and that's because of I suspect, the protocol that we have in place the alertness of those who are involved, the fact that the health authorities do keep in touch and provide appropriate levels of guidance. So nothing yet as it relates to our prisons. We did have a scare as it relates to an infirmary in St. Anne, but we were able to deal with that quickly and address that particular threat at the time.
All right, I see Damien trying to get another one in. Or real quickly, Damien. Yes.
No, I'm sorry, the minister has not responded to the question. I'm asking him for the outcome of the assessment of the current protocols in the prisons.
I thought I did answer, but the protocol that was put in place in conjunction with the prison authorities and the Ministry of Health has been implemented, is being monitored, and the outcome is that we have not had any cases of COVID within the prison system. I'm not sure if that's the question you're asking. So far, so good. We have been abiding by the terms of the protocol, and we have not had any issues in the system, in the prison system.
All right, thanks, Damien. Let's go to Vanessa Silveira, JIS. Vanessa.
Hello, can you hear me?
Yes, go ahead.
All right, thanks. Happy Independence Day, everybody. My question is, doctors have been having difficulties when trying to call in to report suspected cases of COVID-19. Are the hotlines for the medical professionals still active?
And the short answer to that is yes. We still have a team of persons who man the switchboard or the lines. And as I am aware, CMO, we don't have any difficulties with the line. I don't know that there's any. If you try and you don't get through on the first go around, then we would certainly encourage you to keep trying. Or alternatively, you could call the health department in the parish or your community health center, the one that you're closest to or the one that you normally visit, or the hospital in the particular parish. So the hotlines are dedicated to dealing specifically with COVID-related issues, but frankly speaking, anywhere in the public health system, whether at the primary level or at the hospital level or the parish level, could provide you with information.
Thank you so much, sir. We'll take two final questions then. Let's go to Dion Jackson Miller, RJR. Mrs. Miller.
Thank you so much. Yes, thank you so much, Naomi. Two questions. One, based on what Mr. Desmond McKenzie, Minister McKenzie had said about the number of unapproved events that were going on, plus the fact that numbers have been increasing for about a week now. A lot of people were expecting increased curfew restrictions for the holiday week. Why did that not happen? Especially given the fact that the public health experts have been saying that is what is needed. And the second question, it seems as if what you're describing in relation to those two churches had been call centers, they would have been locked down. Why this reluctance to put the churches under manus?
All right, so let me take on the second question, and then I'll ask Minister McKenzie, who is here, to address the first. I think the Prime Minister was very clear, and as late as today, early as today, he had a discussion with church leaders coming out of the discussions that we had in our cabinet subcommittee meeting. And there is a general consensus that the vast majority of churches are complying with the protocols that have been established. They have, I think, very effectively self-regulated in terms of being aware of the threat and put in place a number of procedures to address the threat. Of course, there are others, as is the case with this particular situation that I described, where the protocols were not observed. I don't want to compare the churches with the call centers. The fact is, the call centers are functional now. When we had the outbreak, we did go in. We restricted initially, adjusted for the protocols, and they resumed. The same would apply as it relates to the churches. And as the PM said earlier, announcements will be made that are specific to worship over the coming days. He did mention conventions, for example, as one type of church event that would be restricted for the time being. So it's not that measures won't be reviewed. In another day or so, you will hear of what the specifics of those measures are. Minister Mackenzie, you want to take on the first question?
In relation to questions surrounding the entertainment industry, we met with the players in the industry, and a number of suggestions was put on the table. We considered a lot of what was put forward. We considered the investment that was made, and we figured that we could facilitate accepting a commitment from them that efforts would be made to have some improvements in what was taking place. We have seen a slight upturn in the compliance, but as the Prime Minister indicated, we are going to be taking steps which will be announced next week to implement measures to curtail and to bring some level of control to what is taking place.
Thank you, Minister. Our final question then goes to Janet Silvera. Ms. Silvera? Yes, go ahead, Janet.
Thank you. Good evening. This question is to the Minister of Health. A number of persons had to wait in the airport for 4 to 5 hours yesterday, arriving on about 7 different flights, owing to the length of time that it is taking the health aides or the health workers to get through, to question them rather. In fact, I understand that there's been marked reduction in the number of health workers in the airport. For instance, there were 12,000 passengers that came in yesterday, but there were only about 12 or 13 health workers to deal with them. They say that the money to work in the airport is a little bit too low, so they're not gravitating towards working in the airport. Does the minister have anything to say about that as it relates to beefing up the number of persons in the airport? Because visitors are complaining that it's taking too long to get out of the airport.
Okay, well, firstly, based on my visits to the airports, and I try to do so, once every few weeks or so, just to see what's happening, I would describe yesterday as an anomaly from what is normally the case. The truth is that the reports that I get on a relatively frequent basis is that it should take about an hour or so to move a passenger through all the processing that is required at our airports. So the extent to which persons may have been there for 5 hours, I would check on that. That certainly is not the normal situation. As I understand it also, we still have about 100 or so persons between the two airports. So the 12 that you speak of would again be something worth looking into, but that's not normally the case. What I would say, however, and it's important that we make the connection between what is happening in the rest of the country and the finite number of workers that we have as part of the COVID response health team, and the need to do the community surveillance and the community response that is required, particularly when we have flare-ups. And flare-ups, frankly speaking, that could have been avoided, but because of a lack of observation of the protocols that exist. It's so important, and I say so respectfully, that Jamaicans understand that the authorities, whether the government or more specifically the public health authorities, cannot be everywhere all the time, overseeing everyone and literally spoon-feeding persons as to what they need to do in order to reduce or minimize the risks. Something is going to give. And frankly speaking, where we have the flare-ups, we have to reassign or relocate resources. I don't know of the specifics of yesterday, but I know that could be one of the reasons, because you have to move persons around. And it's not just about the persons who are the cases that are known in media, because as I said earlier, there are a number of cases where we are doing work in communities without much fanfare or publicity based on observations of positive cases. So I'm sure there's some of that taking place on the western end of the island, if you're referring specifically to Sangster International Airport. But I'll look into the issue as it relates to yesterday, but I would think that it's an anomaly because that's not normally the case.
Thank you, Minister. May I also thank all the officials who've been here, the Prime Minister, the Most Honorable Andrew Holness, yourself, Minister Tufton, as well as Minister McKenzie, P.S. Sewell, the Chief Medical Officer, Dr. Bisesa McKenzie, and of course the acting PS in your own ministry, Minister Ms. Fabia Lamb. Also for members of the media, congratulations as well to all those who have had national honors conferred on them, which include the manager, I think he's now returned to the Gleaner, Garfield Grandison, Barbara Ellington, who's been at the Gleaner for several years, Pat Lazarus, a veteran in broadcasting, and Henry Stennett. Thank you all so much, and certainly next time, once we have a press conference, we'll announce, and we look forward to seeing you then. Happy Independence, everybody. Take good care and be safe.